Hey, this is Dr. Jack Wolfson, the Paleo Cardiologist of the Doctors Wolfson, and I'm a board certified cardiologist, and I have a lot of people from all over the world that come to see me for atrial fibrillation. And very often, when it comes to blood thinners and atrial fibrillation and stroke and atrial fibrillation, patients are very confused, and I want to set the record straight for them and really help them make an educated decision as far as what's right for them. So one of the first things I do with my patients when they have atrial fibrillation and they are concerned about stroke risk, or they've been prescribed pharmaceutical blood thinners such as warfarin, otherwise known as Coumadin, or one of the newer drugs like Pradaxa or Xarelto, I show them this website, and it's called chadsvasc.org, and you can see it up here on my screen on the top left. So on Chad's Vasc, you can go there and you can actually get lots of different information, and you can figure out what your stroke risk is, and then you and your doctor can decide what's right for you. So let's take a look over here where you plug in your risk factors. So you go through this checklist: congestive heart failure. And if you do have congestive heart failure as identified by this criteria, then you would give yourself a point, and so on and so forth. If you've got hypertension, or you're on pharmaceuticals for hypertension, high blood pressure, you get a point. Age greater than 75 gets you 2 points. 65 to 74 gets you 1 point. Diabetes gets you 1. Stroke or TIA by history gets you 2 points. History of vascular disease, like you've had angioplasty, stent, or previous bypass surgery, that gets you a point. And if you're a female, you get a point. So say, for example, let's take Jack Wolfson. I am 46 years old. I have never had a history of congestive heart failure, never had hypertension. My age, I'm 46, no diabetes, no history of stroke, no history of vascular disease, and I am a male. So my score is a 0. So we go over into this side and we see Chad's Vasc score of 0. My chances of having a stroke are 0%. If I was in full-time atrial fibrillation. So we're not going to make it much lower than 0% with any form of pharmaceuticals. Well, now let's just take the 67-year-old female patient with hypertension. So that person would get a point for hypertension, they get a point for age, and they would get a point for being a female. That's a score of 3. And now you go over here to the Chad's Vasc score of 3, and you can see that they're at a 3.2% stroke risk on a yearly basis. Now that's not 0, it's still 1 out of 33 people in that category are having a stroke on an annual basis. But what I try and do is I try and tell people that I don't want your risk of having a stroke to be 3%. And with a blood thinner, the pharmaceuticals, you can lower that risk down to about 1 to 2%, which is still some improvement, but it's not actually getting rid of all risk. And of course, there's a risk of bleeding on those heavy-duty blood thinners. So what we do is that we talk about ways to, number one, eat the right foods, which the people in these studies are not doing, to live the right lifestyle, such as getting sunshine and sleep, and also getting chiropractic care. We talk about staying away from environmental toxins. We talk about getting grounded. We talk about all the things that I talk about in my book, The Paleo Cardiologist, The Natural Way to Heart Health. But once again, it's about giving people the information. Now, you may think, hey, the Chad's Vasc score of 3, at 3%, I'm not overly concerned about that. Maybe there's some natural blood thinners that you'd be interested in. I use a lot of nattokinase in my office, and vitamin C and vitamin E and garlic. There's a lot of things that if you help keep the body working appropriately, even omega-3s have a benefit in this category. If you keep the body working appropriately, your stroke risk is undoubtedly going to be lower. So these are just some options for you. This is a fantastic website. This is not a natural website. This is not a holistic website. This is a website created by mainstream cardiologists to get this information out there to the public. And now you know it as well. Until next time,